Hello. Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. I'm sorry, extremely sorry, because we started our live video with Dr. JB, but unfortunately there were some technical issues, so we could not connect to each other. So that's why we are again starting the video again. So what we are discussing in our previous video regarding the lifestyle changes and male infertility and male sexual dysfunction, what we have said that undescended testicles, we were discussing about undescended testicles. Sometimes there are some men who don't have one or both the testicles inside the scrotum, and surprisingly they have not visited their doctors for a single time, and even their parents did not visit their doctors for this problem when they were children. So this is very unfortunate. So we must be aware of this thing, because not only that these undescended testicles can cause infertility, but at the same time these undescended testicles may be associated with cancer in the testicles, so they must be removed. Now we were discussing about the different types of male infertility. At the same time we have to discuss about the different types of male sexual dysfunction, like one, because these are intimately related to infertility. One of the type of sexual dysfunction is erectile dysfunction. I'll say this is the commonest type, that is inability to achieve or hold erection until the point of penetration. It may be psychological, but all the causes are not necessarily because of psychological things, because the diseases, it may have some other issues, other serious issues, because it may be a early sign of heart disease, so it may be potentially life-threatening. So if you have problem in your penis erection, don't ignore it. So you have to talk to your doctor. It's very dangerous to take Viagra without consulting your doctors, because if the erectile dysfunction is because of heart disease, and if you take Viagra, you may have dangerous side effects. At the same time, diabetes, it may be a sign of diabetes, and some other diseases, like some diseases in the nerves, some other hormonal problems, testosterone deficiency, high prolactin levels, pituitary gland problems inside the testicles, all, and some hormonal disorders, genetic problems, some problems inside the penis, like anatomical disorders called Peyronie's disease, where the penis shaft is not having adequate blood supply and is bent abnormally. In that case, the erectile dysfunction can happen. The second most common cause of male sexual dysfunction, or type of male sexual dysfunction, is ejaculatory dysfunction, of which premature ejaculation is common. The reasons may be almost as same as that of erectile dysfunction, like diabetes, like problems in the nerves, etc., etc. The third type of disease of male sexual function, which is not very common, but we do get to see these patients sometimes, like delayed ejaculation, that is, man is not able to ejaculate in time, or absent ejaculation, that is, he is not at all able to ejaculate during intercourse. The reason may be some disease in the prostate glands, some nerve problems in the nerves, some surgery in pelvic area, or diabetes, or even spine injuries, or having some spinal cord diseases. They may have this type of effects. But if you can remember, our main topic of discussion was how lifestyle changes can modify these diseases, whether we can improve male fertility and male sexual function by lifestyle changes. So before understanding how we can modify and how we can treat it, we have to know how lifestyle is affecting these functions. Number one is that lifestyle may have some weight, excessive weight. Obesity may impact male reproductive function. You know how? Please note, in the women, the ovaries are situated inside the abdomen, inside the tummy. But in men, testicles are hanging outside the body. They are lying outside the scrotum. Why? Because the sperm production needs relatively cool temperature. The temperature in the scrotum should be at least 3 degrees Celsius less than your body temperature. That's why they are hanging outside the body. So if by any reason your temperature in your scrotum is raised, you may have this type of problem. How obesity is doing that? Because of obesity, there will be fat deposition in the scrotum and your scrotal temperature will rise. At the same time, obesity may be a risk factor for heart disease, diabetes, etc. This may lead to erectile dysfunction and sperm problem. And again, obesity may hamper normal sperm production and normal testosterone production. So all will this lead to male reproductive problems. At the same time, diets, that is, if you don't follow a particular balanced diet, if your diet is rich with junk food, high calorie food, what happens? There are something called estrogen and testosterone. You know, testosterone is a male hormone, estrogen is female hormone, but men also have small amount of estrogen. But if you continue to take excess junk diet, then your estrogen level will rise. As a result, your testosterone and estrogen level will become abnormal. That may be the reason of abnormal sperm production or erectile dysfunction. At the same time, prolonged sitting. If you sit for a long time, if you are used to prolonged driving, prolonged biking, even prolonged cycling, what happens? Your pelvic area, scrotal area is continuously in touch with some chair or some surface. So automatically the temperature of scrotum will rise. As a result, your testosterone production will drop down. So you may have these sexual problems. At the same time, your sperm production will be compromised. Other issues of lifestyle changes are important, like using tight undergarments. Same reason. If you use tight undergarments, your scrotal temperature will rise, and so you may have difficulty in your reproductive function. Keeping laptops or working with the laptops, keeping the laptops in your lap continuously, or mobiles in your pocket or in your trousers pocket may have the same effect. At the same time, smoking, alcohol, they do play a lot of role, but we often ignore one important thing: sleep. If you don't have adequate sleep, what happens? You may have something called sleep apnea. You may have daytime dizziness. Particularly if you are obese, you may have sleep apnea, and sleep apnea will disturb your hormone levels in the body, and the result will be either your fertility problems or problems in your sex. Now, the second thing that can happen is that some hot bath. If you are used to take hot water bath, then the same problem can happen. And please remember one important issue. Often men, they take testosterone tablet or testosterone injection just from the pharmacy without consulting the doctors, even without checking the testosterone level in your blood. Please remember, even if your testosterone level in your blood is low, if you continue to take testosterone, in majority of the cases, testosterone will shut down your sperm production. So what happens if you take testosterone? Of course, you can take testosterone if you are having low testosterone, but provided if you don't want to become father. But if you want to become father, if you want to preserve your fertility, please don't take testosterone, even if you have zero sperm count or if you have erectile dysfunction, because testosterone ironically can affect your sperm count. So please take care of it. So what are the things you can do? Of course, we doctors are there, we IVF specialists are there to treat your problem. But plus, first of all, please remember, often these people are coming to our clinics and asking for medicines. Please remember, we can give medicines. Before giving medicine, we have to be sure that these medicines will work and these medicines are not going to harm you. For example, I've said about testosterone, so we don't give testosterone. Before giving medicine, we have to make sure whether medicine should work for you or not. That's why we need some investigation. We need to examine you. We need to examine your body parts. At the same time, we need some blood tests. If you are having fertility problems, we need to know your semen analysis, exact sperm count, and that must be repeated from a good laboratory, because if you have abnormal sperm count in a single semen analysis report, that does not make any sense. We have to report it from another laboratory. At the same time, we need some blood hormone investigations like blood sugar, prolactin, FSH, LH, testosterone, depending on the severity. Sometimes you may need some ultrasound, like ultrasound of your scrotum. In some cases, if we suspect some obstruction, you may need some ultrasounds called transrectal ultrasound, which is done by inserting ultrasound probe in your rectum to see your prostate gland in better way. The only case of male fertility problems where medicines will work in magic manner is if you have pituitary gland problems. In that case, if you take this hormone like FSH or HMG injections, that is, you are giving hormone supplementation, you don't need any further therapy. But in other cases, if the problem is solely because of sperm production, majority of the cases we may not be able to cure your problem, but we may help you to become father by some techniques like IUI, intrauterine insemination, if you have mild to moderate problems in your sperm. If you have a severe defect in your sperm, in that case you may need IVF or ICSI, intracytoplasmic sperm injection, where the eggs from your wives will be collected and your sperm will be injected inside the eggs, and then the resulting embryos will be transferred back inside the womb of your wife to give her pregnancy, and you have the chance to become biological father. And even if you have zero sperm count, in that case you may collect the sperm from your testicles by some very minor operation called TESA or TC, and you can collect the sperms and do the procedure. But if without these things, like without going this to this medical treatment, can you have any other options? Yes, lifestyle changes play a lot of role. First of all, as I have said, there are some things that may cause this type of problem, so avoid this. Avoid using your scrotal temperature, so avoid hot undergarments, avoid prolonged biking, prolonged cycling, and prolonged sitting. If you are used to prolonged sitting, like your office job demands prolonged sitting, just take a break after 1 or 2 hours, just move around and then again restart. If you cannot avoid prolonged driving, just take rest for a while, for 10 minutes after 2 to 3 hours of driving or biking. Avoid taking hot water bath. Of course, alcohol and smoking, probably you know better than me how avoidance of alcohol and smoking can help. Diet, not only low calorie diet, but diet should be rich in antioxidants, vitamins and minerals. In fact, we do prescribe antioxidants when we find mild to moderate defects in sperm production, because antioxidants, they have immense role in improving your sperm count and sperm motility. And there are some antioxidants which can also help you to improve your erectile function. At the same time, this weight control, exercise, and exercise is extremely important, because exercise will reduce your fat. At the same time, please remember, your fat is a rich source of estrogen hormone. So if you do exercise properly, if you have proper dieting, what happens? Your estrogen level will go down, so the testosterone estrogen ratio will be restored, so you may have better sperm parameters and erectile function. But another thing is very much important for men who are suffering from erectile dysfunction or ejaculatory problems, that is main sexual function: pelvic floor exercise. There is an area called perineum or pelvic floor, that is the area lying between your scrotum and the anus, and there is a muscle called pubococcygeus muscle. If you know how to squeeze this muscle, we call it Kegel's exercise. This is very much helpful in improving your erectile and ejaculatory function, because erectile dysfunction occurs. Why? Because the main reason for having erection is that you must have adequate blood supply in the penis. So this muscle helps to improve the blood flow in your penis. In fact, we give some medicines to you after checking. Okay, all these drugs are acting by improving the blood flow in the penis. Okay. So this is called Kegel's exercise, and please remember, it's not a very big thing. You don't need to go to gym. You don't need to have special time. Even you can do this Kegel's exercise when you are doing your work, when you are at your office, when you are at home, when you are walking, when you are going to a market or some other purposes. Okay, it does not need special time, because nobody can understand that you are
Hi.
doing this casual sex. Hello, JB.
Hi, I think you can see me. So it was a great discussion. Like,
Yeah. So fortunately, I got rid of this monologue or some monotonous discussion. At least we can have some dialogue and the conversation, because it's sometimes difficult to continue to speak alone without any help of others. So thank God that the connection
but
issue
you did really great job.
has been settled. Thank you.
I appreciate, and the way you explained, like some of the things I didn't know, and the way you explained all the things from sleep to underwear to laptops. So can you tell me that if there is any studies related to the electronic devices?
So sorry, I could not get your point.
Electronic devices. You said that electronic devices can have some harm.
Yeah. It's little bit controversial, but there are some. I won't say there are a large number of studies. Okay, but there are few studies which have mentioned that maybe some heat emitted from these electronic devices, and maybe the electromagnetic radiations emitted from these devices may have some impact, particularly in sperm production. Of course, you know that heat is associated with increased scrotal temperature, and they may affect the testicular function. At the same time, the electromagnetic radiation may affect the sperms, particularly sperm motility. Even if you have normal sperm production, the motility, that is the ability of the sperm to move properly, to move inside the female reproductive organs, may be hampered significantly because of electromagnetic radiation.
That's a really important point. Like, it's not about the number of the sperm, also the motility of the sperm, which matters.
Exactly. What we see in semen analysis is not the count or not the motility in isolated manner. We see what is called TMC. It's not Trinamool Congress, please remember. TMC is total motile count. That is total motiles count. That is the number of sperms in your semen per ml which are having good motility. That this is because these are the sperms which have the potential to go inside the fallopian tube of a woman and fertilize with the eggs. So that's why we see both motility and count. So both are equally important.
Okay, so can you explain a little bit about the sleep topic which you touched? Actually, what are the things like what is sleep apnea, how sleep apnea can be related with these issues?
Okay, what happens if you are obese? You have increased fat deposition inside your neck area, inside your throat area. Okay, we call pharyngeal fat deposition. So what happens when you are sleeping? That time your air passage will become little narrower than other healthy people. As a result, your lungs will not get adequate oxygen. So you may have snoring. Particularly, you may notice sometimes your partner may say that, oh, this guy is snoring all the night. So don't ignore snoring. Snoring may be a sign of sleep apnea. Apnea means, apnea means absence of oxygen. The snoring is a sign of sleep apnea. So please remember, if a guy is snoring, this is not intentional, because he must be having some serious problem. If you have sleep apnea, this may affect your lung and heart function. At the same time, it has been seen that this sleep apnea will alter your testosterone and estrogen hormone balance in your body. As a result, your sexual function, that penis erection, is going to suffer. Another reason why this man with sleep apnea are having erectile dysfunction is because as I mentioned, the erection requires adequate blood supply to the penis. If you have some problems in blood circulation in any parts of your body, even if you have high blood pressure, if you have heart disease, your blood supply to your penis will be sacrificed. As a result, As a result, if you have sleep apnea, the same thing happens. Your blood supply in your different parts like heart and lungs will suffer. As a result, the penis will also suffer. So sleep apnea is important. At the same time, as sleep apnea is associated with low testosterone level and high estrogen level, sleep apnea may be a risk factor for causing
and you are in the cycle,
infertility.
like you are in the trap. Once you can't really cure the snoring related problem, you really going to the trap, and then you are having more and more insulin resistance, diabetes, heart problem, cardiac problem, as well as sexual problems, psychological problems. So you are in the trap. So it needs also multidisciplinary
Exactly.
approach to treat.
Yeah, this is very much important. It's good that you raised the issue of diabetes. Thank you for remembering it. We have seen some patients, they didn't know that they are diabetic. They presented to us only with low sperm count. And after evaluation, we found that he's having diabetes. And recently I've got a man who had almost normal sperm count 3 years ago. 2 years ago, he had been diagnosed with diabetes. He was advised to take anti-diabetic drugs by endocrinologist, but somebody told him that don't take it because once you start it, you have to take it for whole life, so don't take it. Now the man presented to me in the year 2019, and now I repeated semen analysis from 2 labs, and you know what's the result? It's azoospermia. That is, not a single sperm has been seen in his semen, and the reason is diabetes. Even if now his diabetes is well controlled, the damage has already occurred. So sometimes diabetes may present with erectile dysfunction. That's why it's not a good idea to take Viagra directly from the medicine shop, going to medicine shop and say,
just to get some like parasympathetic activity and erection, they are going, but they are actually on the other hand, they are putting different kind of diseases away. Like they are not finding the cause. They are not treating the cause. It could be sleep-related problem. It could be hormonal problem. It could be even other metabolic issues, or could be some tumor. So they are thinking and trying to solve the erectile dysfunction with some markedly available drugs, but that is not the way you should find the cause and treat it.
And particularly sometimes this Viagra may have some dangerous effects, particularly like if you are having heart disease, or if you are having some drugs called nitrates, if you are taking it for your high blood pressure, if you are taking Viagra along with it, you may have dangerously low level of blood pressure called hypotension, and that may be life-threatening.
Okay.
Another thing is that if you continue to take these medicines Viagra without consulting the doctors, of course you have to consult the doctors. It's a fact that we sometimes prescribe these medicines, but we prescribe after thorough evaluation.
That's the main
because
thing.
before prescribing any medicines,
like being a doctor like you have studied that much and then have experienced that much, then even we are sharing the experience. Like even you worked in different part of the planet, I worked in different part of the planet as well as in India, and the things are that vast, we are still sharing. But people think that just searching on the Google you can solve the problem, but it's not that easy. You really need to trust your doctor and go.
And even another, that's why we often also prescribe Viagra, because Viagra is a very good drug. It improves the blood circulation in the penis. But please take it after consulting the doctor and make sure that your erectile dysfunction are not related to some serious disease like heart disease, diabetes, testosterone deficiency. Because the men who are having diabetes, they may have testosterone deficiency, and the men who are having testosterone deficiency, they are having short lifespan. So please go to doctor and evaluate properly. And there are some other issues, like we have seen the men who are taking Viagra because they used to take Viagra 50 milligram. It was not working. Then they went to medicine shop and they by themselves increased the dose, and they ultimately landed up in priapism. You know what is priapism? That is continuous. Yeah, that is. I'm telling for the audience. Yeah, priapism is continuous erection of the penis, which is usually painful without any sexual stimulation. So just imagine that you are having erect penis for a long time without any stimulation,
And that is not
and
really
that may be harmful.
Yeah,
that may in the long run they may actually hamper your blood supply, your penis, so your further function, the further sexual function will be
maybe some
compromised.
surgical intervention
So
will be necessary to have the blood pressure, because this is not a good thing that the penis is erected.
exactly,
One thing I want to mention,
exactly, often surgical intervention,
because as I suffer from the sleep apnea, I would like to say that it's not only those people who are having obesity, it could be with the lean people also, or that different kind of anatomy. If they have the anatomy in the pharynx, or the oropharyngeal anatomy, and
or short neck, particularly,
and also thick neck. It has been seen with studies like more than 17 centimeter neck, like thicker neck, is associated with central sleep apnea. Obstructive sleep apnea. And another thing is with the sleep apnea, as you have the adrenaline, like you are not getting the oxygen, so you are in the you have the fight and flight mechanism. You are more. And your brain can't take place. And totally, I think. Otherwise, whatever it could be bad cow, or other, because it can, even the diabetes will not be corrected if you don't treat that. So I will say that try to find the reason and then treat it. And for that you need to have doctors like you, redirect them.
Not only it's not a single man's show. We need multidisciplinary approach. We of course need from infertility and reproductive function point of view, of course we need to consult some infertility specialists. At the same time, the role of dietitian is just simply indispensable.
This part like could be corrected by us. Also the role of exercise.
The role of exercise cannot be underestimated, because as we have mentioned, we have some treatment, but treatment will likely to work when you have optimum weight. And of course there will be some exercise expert who will teach them how to maintain the proper lifestyle, like avoiding hot undergarments, avoiding laptops, smoking, avoiding hot bath, etc. At the same time, the pelvic floor exercise is very, pelvic floor exercise or Kegels exercise is very easy to perform, but it's very difficult to make somebody understand unless you learn it from some properly trained people, because majority of the people are not doing this pelvic floor exercise properly. When we advise them to pelvic floor exercise, they often just squeeze their abdominal muscle, the muscles of their tummy or muscles of their buttock, okay, the gluteal muscle. Majority of the men, the people, they don't know what is actually the Kegels exercise. Kegels exercise is very easy to do, but it's very difficult to make understand unless you have visited some proper trainer. At the same time, the role of endocrinologists, diabetologists in particular is important.
Everything, like we really need to put the hands together, and more and more I understand the importance of the multidisciplinary platform, like Get India Fit, and we really making a program like that way. On dashboard, everything can be visible by the top.
And of course, we have to sometimes we have to take the help of urologists, because there may be some urological issues that may be corrected surgically. And for obstructive sleep apnea, some sleep specialists or specialist ENT doctors who are interested in sleep apnea disorders, because there may be some need of some airway management strategies that may be needed. But of course, what you can do by yourself is the lifestyle changes, because please remember, often lifestyle changes, you don't have to spend a single penny.
Yeah.
So but you need some proper trainers.
Yeah.
So I'll request people, if you are suffering from this type of problems like male infertility or sperm production problems, or problems in sperm motility, erectile dysfunction, ejaculation issue, premature or delayed ejaculation, if you need any assistance for lifestyle changes, please don't hesitate to contact any multidisciplinary team. Like I'll say, Get India Fit is a very good platform where you get access to this multidisciplinary team very easily.
Team, and we have the ideas how to do it. Because we not only see the testosterone level or other hormone level, we try to find the cause, as well as we try to find all the modifiers. Might be in the sleep, might be in the nutrition, anyone, and take it aggressively. If we all think we take it very aggressively, try to find the details and
Yeah, what you have said is very important. And the thing is that we don't only focus on improving the testosterone level. When the patients are coming to us, majority of the time patients are concerned about the report. Doctors, my testosterone level is low. Doctor, my sperm count is this. We said, please remember, we are not going to treat the reports. We are going to treat the patients. That's why you need to see the patient as a whole. We need to take proper information. We have to gather proper history from the patient. We have to examine the person. We have to go for some investigations like blood test, semen analysis, ultrasound, etc. Because we have to see the overall picture, why this is happening and what we can do to improve your reproductive function. So please, we are no longer treating any report. So when we tell the patient, okay, why have you come? Sometimes they just take out the reports from their bag and say that my report is. I said, no, I'll see the report at the last. First, I want to know from you, what have you come and what is your expectation from me, because I'm not going to treat only this.
That's what I like
my
about
job is not only to.
You are more concerned about the patient and the outcome. And that's why I have a big respect towards the thing. And the infertility clinic you work for, they have the same strategy. That's what I like. And it's not only about finding the problem, finding a holistic solution, working on all the modifiable parameters, then we can really fight. I think we can today this discussion because it's already so we can make the video second part asking people out, I mean regarding the subject, small subjects
and because this is
because people will be benefited.
I think this is our video, a video of first of its kind today, because last time we discussed about the polycystic ovary and lifestyle management. So I think today we got some broad idea about the problems like male infertility and sexual dysfunction. But from next time we can divide it in small parts, like
I'm going to more specific
azoospermia. More specific manner, exactly, like azoospermia or oligospermia, erectile dysfunction, premature ejaculation or delayed or absent ejaculation, etc. In that case, we can divide it in small parts, and so we have more discussions on these specific issues, because today we could not address all the specific issues in much details. So we hope in next time we can do that.
we can do that. Thank you for appearing here, and thank you for withstanding even after technical problems you stayed there.
I again apologize to the audience for not being in time and for the connection issues. That's why we have to disconnect and start the video again and again. So we had I think the video will be in 2 or 3 parts. We could not do it in one part. We are really sorry for that.
We are sorry for that. So you can actually cut the video, and we have to share the video. Then this video will be existing. Otherwise, it will be deleted. So thank you. Good night. Bye bye.
Thank you. Good night. Bye bye.